So myself, I am Mantu Akon. I am an optometrist, and also I'm attached with some teaching institute as a associate professor. And today, my team from the REFOCUS, Arsalan, and Sohel, and definitely Rakib, they are my fellows and intern. They are doing. Arsalan is doing his internship here, and Sohel also, and Rakib is doing fellowship here. So we'll just discuss about some few things, like how basically we'll discuss about non-strabismic binocular dysfunction, because its binocular is very huge things. It's very difficult to discuss all of these things, right? Whatever you have query, you just feel free ask, so then you can give the valuable input, right? So before we starting, just you have to just basic things you need to understand, like what my everywhere wherever I go I ask like what you understood by the vision first, right? Thus as optometrist you are dealing with vision, right? So what you understood, so can I know from students please whatever you understood, so you don't feel like it's not your exam, right? So you just say whatever you feel. Yes, whatever you feel, like what you understood by vision.
There is something we can perceive our environment.
Right.
Know our environment.
Very good. Anything else? Anything difference? What you understood by vision?
The perception of surrounding optical.
Okay, so means basically you are saying surrounding your environment and all. I'll just give you one example. It's very interesting example, so you understand better, right? Uh, you just think about one tiger, right? Everybody you like to see tiger, right? So you see tiger in maybe in photos or phone, right? Tiger you are seeing in zoo, you are going and you are enjoying, they're playing, right? And you just think about that when tiger is come to use, like in an open space. So means what?
We have to run.
means your reaction action will change. Yes, everywhere when you seeing in the phone, हाँ ये टाइगर तो मैंने देखा है, बस ऐसे इसको अपने क्या कर दिया, राइट? आपने जू में देख रहा, हाँ एंजॉय कर रहे हैं, ये कर रहे हैं, वो कर रहे हैं, थोड़ा सा उसको आप ये कर रहे हो, right? But when it come to you, like suddenly you are in surrounding in some environment जहाँ पर suddenly आपके पास आ गया, right? So your action and reaction. So vision is action and reaction, right? So if I talk about action and reaction, so means vision is everywhere. Yes, agree or no? You just think, do you think anything you can do without vision? Whatever. Just close your eye and just see how you'll feel. Right? So everywhere is a vision. Everywhere. Whatever you are doing, even I'm talking, my vision is requiring. Whatever you are understanding, whatever you are seeing, so that is also vision is important. Right? Now, there is a two concept of vision. One is Dr. Skeffington, he is a father of behavioral optometry. He first developed one behavioral model of vision. What is that? It's a four pillar of vision. The first is that is called identification. Means anything to identify. Identification, visual. Like if I draw a circle, this circle if I put in different background, will you able to understand or not? Sometimes sometimes we say that is visual hallucination or whatever we say, right? You draw a circle, this background, this background, this background, will you able to differentiate the same circle or not, right? So that is called visual figure ground. Means कोई भी पर्टिकुलर फिगर पे आप कोई भी एक चीज़ को आप आइडेंटिफाई कर पा रहे हो नहीं कर पा रहे हो. आई हैव लॉट ऑफ पिक्चर्स, आई डोंट नो राइट नाउ, आई हैव नॉट, देन आई कैन शो यू के मे बी जब पहले आप देखेंगे कि आपको समझ में नहीं आ रहा, देन आफ्टर फ्यू सेकंड इफ आई से दिस इज दिस, देन ओ हाँ हाँ राइट राइट, ठीक है. सो दैट इज कॉल्ड आइडेंटिफिकेशन, एनीथिंग टू आइडेंटिफाई, राइट? Then is related to your anti-gravity, which is very important. You just think about that when child, after born only, if you see the visual development of the child, from few month के बाद से the anti-gravity child they started. First what they do, they roll themselves. जब छोटा 1 month का 2 month का 3 month का है, so they try to roll them. Yes, कि एक बार इधर घूम जाए, एक बार इधर घूम जाए शुरू में, then they overall roll. So why? Because they are trying to create anti-gravity, right? Then what they do, they try to little bit सिर्फ head को, थोड़ा सा हेड को ऊपर करे, राइट? सो देयर इज अ लॉट ऑफ प्रीमेटिक रिफ्लेक्सेस इज देयर. सो प्रीमेटिक रिफ्लेक्सेस का इसका रिलेशन है, राइट? सो एंटी ग्रेविटी, देन दे स्टार्टेड क्रॉलिंग, देन दे स्टार्टेड वॉकिंग, राइट? ऐसा नहीं है कि शुरू में वो क्रॉल अच्छे से करने लग गया, शुरू में थोड़ा सा बैठने लगा विद द सपोर्ट ऑफ सम पिलोज और सम थिंग्स, देन separately. So means what the child is doing, the creating the anti-gravity awareness. And the anti-gravity awareness is created when baby is in the uterus only. वो मूवी देखा है ना आपने, किक किया, 3 Idiots? Yes. So that mean what? जब भी प्रेग्नेंट मदर आफ्टर अराउंड 4 to 5 month के बाद जब भी कभी ऐसे झुकते हैं, कभी बस एनीथिंग, so the child already have anti-gravity created, so they will feel okay, maybe I am falling down. Yes, this is the reality. Okay, so anti-gravity is everywhere. Without anti-gravity you cannot, आपका vision को आप कुछ नहीं कर सकते हो. And the latest research neurologists, they are saying that our vision process throughout the brain, that the only sense, that is the only sense which is involved throughout the brain. एक विजन को प्रोसेस होने में, आई एम टॉकिंग अबाउट नॉट टॉकिंग अबाउट द विजुअल एक्यूटी, आई एम टॉकिंग अबाउट द विजुअल प्रोसेस, राइट? सो विजुअल प्रोसेस होने के लिए आइडेंटिफिकेशन, एंटी ग्रेविटी, देन स्पीच एंड ऑडिटरी, स्पीच एंड ऑडिटरी बोथ. इफ आई से, you just see one thing, nowadays maximum child, because I see lot of patients this type of, the speech is delay. Can you tell me why nowadays, why is the speech is delay? hey, मोबाइल, वन वे कम्युनिकेशन, ठीक है? पेरेंट्स ने क्या मोबाइल दे दिया, देखो आप बैठे बैठे फ्रॉम 6 month, because we are living in nuclear family. You just think about that. Right now maximum we are living in nuclear family, and previously what you should do, we are stayed, yeah, please, we used to live in joint family, right? So the lot of communication can, yeah. So lot of not one way communication, 2 way communication, 3 way communication, right? Agree or no? Yes. But because of the one way communication, the child are, the speech is getting delayed, right? So speech and auditory both are important. If you read the so-called blind, I don't say blind, I'll say impairment of patient, like a patient is impairment from the childhood. If you read the visual development of impairment patient, they are developed as normal as a normal patient. That is surprising. Even when I read that, I was also surprised. How? Right? There is an institute in US, the Blind Eye Institute. They are working on that, right? So they have concluded that even like if I, how many visual pathways there? Visual pathway, only one? Yes, only one visual pathway. But recently I have attended a neurologist conference and I have come to know there is 11 branches of visual pathway. 11. Still now we are able to find out the 11 branch of visual pathway. Yes. So how you understand? So we are only like only one visual pathway. हो गया तो गया, right? No. A patient, even we so-called blind patient, also we can stimulate and we can give them a normal visual acuity. Maybe not as a normal person. I have seen a lot of patients, like, I don't know how many you heard about LCA disorder. It's a very common disorder. Not very common disorder, very rare condition.
Sorry.
Yeah, you know. Lot of patient will come with RP. You know, this very common is RP, retinitis pigmentosa. এদিকে আছে, this side. Can you please come here? Right? So this all are some, today I have presentation on that. Like you can see, like where, please, আমি যাবো? Okay. We don't have so much time. Okay. So we are, if you see, like where there is a no, you can say ophthalmological intervention is not there, right? I believe there is no specific treatment protocol for RP, no specific treatment protocol for nystagmus, no specific treatment protocol for other things also, right? So we are doing, and we have a improvement, that video also we have, that will present in the main hall, right? So you can attend and you can see. So means you can do anything, but you have to process your vision properly, right? You have to understand what is vision, what is visual acuity. So third, speech and auditory, right? Same thing. You just think about that. If I make it online, how will I understand? If I speak in doing an online from somewhere else, will you be able to understand that much? No, right? Similar for me also. If I is talking online to anyone, I don't get any interest to speak, because they are teacher, they know, right? Yes, when you do online during COVID time, how you feel? सर दर्द है यार. Yes, क्योंकि सुनता तो है नहीं, सब मोबाइल में खड़े हो, पूछो क्वेश्चन, हाँ, are you there, हाँ सर I'm here. Because you also not feel interest, similar to us also, right? So identification, anti-gravity is very, very important. Chair, বসে যাও, এখানে বসে যাও. Speech and auditory, and one more thing is the important, that is, balance, that is called vestibular system, right? So you just think, you just close your eye, are you able to balance? You see, is changes, right? When you open, we have a midline over here. So because of this midline, we are able to stand properly. You just think about the patient with, I don't know how many you heard about cerebral palsy patient, jinko, right? So why the posture is like that? Because the posture is, if you are turning towards this side or this side, so gravity is there, gravity will try to pull it, and over time of period, muscle भी ऐसे developed हो जाएगा, right? So 4 pillars you need to understand. So one is identification, anti-gravity, speech and auditory, and 4th is balance, right? Now another way, if I explain the vision a little bit, is a many component you need to see. I'll give an example. One patient, the child, or maybe simple headache patient, ekdam simple headache patient. We see a lot of patient headache, and they are roaming from this hospital to this optical, this hospital to the neurologist, to psychiatric to everywhere. Simple headache patient को headache है, and patient is not, whatever what you have done maybe fogging you have done, or maybe you are over. I have seen a lot of patient come with minus prescription, right? And I can show you the magic. Patient is reading 6:9 or 6:12, in the fraction of second. Patient is young, patient will read 6/6, and air, and so whatever you see, that is showing -7.5, right? And if I prescribe that, what will happen? You are inducing the myopia, and the minus power will keep on increase, right? I have seen lot of patients, but problem is that if patient is coming maybe after 1 year or 2 year, I can't do anything because I don't want to do anything with already is cultivated in the system, right? If patient is coming is just wearing 3 month 4 month with 0.75 or -1, I can remove it. But don't think we are not removing the glasses, right? Rather than the prescribing minus glasses, I'll prescribing plus glasses for near activity. And slowly you see the whatever is shifted, slowly is jumping towards this, right? So when we see about vision, like headache patient, ये वाला patient have headache, simple headache, patient इधर से इधर घूम रहा है, उधर घूम रहा है, उधर घूम रहा है, न्यूरोलॉजिस्ट के पास जा रहे हैं, साइकेट्रिस्ट के पास जा रहे हैं, एआर सीटी स्कैन एमआरआई सब कुछ हो गया, पेशेंट उसके बाद ऊपर वाले ने उसको भेज दिया हमारे पास, चलो भाई एक बार दिखा के आ जाओ, ये ऐसे घूम घूम के आ गया, right? And so you have not seen like how the simple cover test, NPC, NPA, simple things. You just check, and maybe I am not telling you headache is only cause of the binocular vision dysfunction. There are 1,000 causes there, right? But this is the one of the most important parameters for the headaches, right? So simply you just see NPC, NPA, accommodative facility, and you will get lot of clue. Lot of patient the coming with nowadays visual stress. Visual stress मतलब क्या है? सिर्फ हेडेक नहीं होना, visual stress is change the entire things of the particular patient. उनका maybe the patient is in studying, or maybe they are in working, right? So all productivity will decrease. Yes. So simple glass prescription can change the patient life. Can you imagine if you think about how glass lens is powerful? There is a book, The Action of Power of Lenses. If you read this book, you will understand.
Which book, sir?
The Action of Power of Lenses.
The Action of Power of Lens.
Yes.
Is it Optometry book?
Yes, yes, sir. You will get in OEP book. That is all our behavioral. Whatever I was talking right now, maybe for you a little bit new. This is what we are talking about, behavioral optometry. So what they are saying, the simple glass lenses can burn your shirt. Yes, agree?
Yes, sir.
So you just think about how effective the lens is. In optometry practice, the most important weapon is your lens prism. That is the first important. Whenever any patient will come, will try to manage with first lenses. Lenses में सी वो 6 दिख रहा है, distance rate no, maximum things is near. I prescribe bifocal. ये लोग है हमारे साथ, तो एक्चुअली मैं बाईफोकल भी प्रेस्क्राइब नहीं करूँ, मैं क्या करता हूँ दोनों प्रेस्क्राइब, क्योंकि इफ आई प्रेस्क्राइब बाईफोकल फॉर 7 year kids और 8 year kids, वो जब दूसरी जगह जाएगा बोलेगा ये पागल है, कुछ नहीं आता है, तो इसको रिफ्लेक्शन भी नहीं आता. दिस वर्ड विल कम. But why you are prescribing? So always I try to explain my patient कि why I'm prescribing. If they are अंडरस्टेबल, हाँ समझ गया तो ठीक है, मैं उसको पहले ये भी बता देता हूँ. आप दूसरी जगह जाओगे तो आपको माइनस प्रेस्क्राइब करके भेज देगा, बोलेगा देखो अच्छा दिखता है, आप बोलेगा हाँ मुझे अच्छा दिखता है, आप चले जाओ. अब गया आप, उसके बाद मेरे पास मत आना. What I am telling you, that is you have to wait for few months and then you will get the result. So my most of the prescription in here. So basically बाईफोकल अगर दूंगा तो पेशेंट बोलेगा हाँ बाईफोकल प्रेस्क्राइब किया है, अभी इस एज में बाईफोकल कहाँ लगता है. So majority of concern they think के हाँ bifocal means in is only for the presbyopia, right? No. So bifocal is important as well for the myopia patient, for squint patient, for visual stress, everywhere. Okay. So visual acuity, visual efficacy, visual information process, and intersensory integration, right? So what you are checking, that is only a visual acuity. How much I can see, that is 6/9, 6/12, whatever, right? Efficacy means your efficiency of visual system, your accommodation, vergence, eye movement, right? Yes, capability means how visual system is deliver your vision to to the brain. ये तो कुछ नहीं कर रहा सर, ये कुछ ब्रेन ही कर रहा है, राइट? एंड इंफॉर्मेशन प्रोसेस, हाउ इंफॉर्मेशन इज प्रोसेसिंग, लाइक वट एवर डिस्कस कि विजुअल विजन कैसे प्रोसेस हो रहा है थ्रू आउट द ब्रेन. दैट इज़ वेरी इंपॉर्टेंट, राइट. उसके अंदर बहुत सारा कंपोनेंट है, लाइक bilateral integration, that is coordination between your right and left hemisphere, laterality, directionality, right left concept, right. Then your visual perception, then your visual motor function, right, eye hand coordination, eye foot coordination. So ये सारे कुछ आप जब चेक करोगे, then you can say your vision is normal or maybe in the within normal limit, right. But without saying, you cannot say vision is normal. So the talk is about basically non-strabismic binocular dysfunction. Okay, what is non-strabismic binocular dysfunction? How you can implement in your practice? So 3-4 things I'll explain about that. So this is my favorite slide. This is for the student also. We want drug right. We want drug right. Yes, we want to prescribe medicine. Yes, everyone. I know student. Everyone want to prescribe medicine. Yes. Yes, yes, but believe me, from last almost 7 to 10 years, I don't say I'll not prescribe. Very very rarely I prescribe medicine. So that doesn't mean you have a branch. Yes, you need to know, okay, how definitely when patient will come, because my practice is specialty practice, that is different. But when you are practicing, definitely you need to know, right? So, but you just see the slide. So you see what is the prevalence up to here? Almost 95%, more than 95% is your domain.
Yes, sir.
Yes. Only few things may you don't require. You can refer. You obviously you need to know. So आप कोई भी hospital, if you go any hospitals anywhere, you see if 100 patient is coming, maximum they are coming from the spect. ऐसा नहीं है कि 100 पेशेंट में 100 ही कैटरैक्ट है. हार्डली 4 to 5% दे आर इन कैटरैक्ट और मे बी इन डिसऑर्डर. 90 to 95% they are maybe primarily come for refractive status. Binocular vision function also is important. May sometimes we are not able to identify that. Okay, yes, I have a problem, right? So you have a huge role. Then amblyopia, strabismus, everywhere. 90% population, 90% patient, they are is for you only, right? Agree or no? Yes. So what is binocular single vision? Two camera is capturing the image, they are fusing, and we are getting three-dimensional thing. A lot of process already I have talked about that. That is called binocular single vision, right? There is a questionnaire from COVD. So like where you will start a binocular examination. Like ऐसा तो नहीं है कि मेरे पास you are seeing 100 patient and everybody you are going to check binocular. That is not possible also, because one binocular vision to check it will take 45 to 1 hour, right? So it is a lot of time taking things, right? So always you see, let's say example, patient have headache or eye strain or whatever, patient don't have any refractive, you are not getting so-called refractive, right? Even we don't believe patient can be a refractive error, we say it is refractive status, right? Both are different a little bit, because nothing can be, it's not an error. I'll give you one example. Have you thought about the myopia? Patient have -12 diopter myopia, patient have 20 diopter myopia. You have seen patient, maybe I hope you all have seen, experience that. Do you check that axial length? You also check that also. Axial length is 23. कहाँ से आया myopia? इतना myopia? 20 diopter myopic. I have seen 25 diopter. That is the highest one. Patient के axial length 23. Maximum patient you will see high myopic 23, 24. बहुत ज़्यादा होना चाहिए ना. वन डायप्टर का अगर 1 mm के लिए 3 हो रहा है, सो आपको कम से कम 32 होना चाहिए. हैव यू सीन 30 एक्सियल लेंथ वाला पेशेंट? आई हैव नॉट सीन एनीथिंग लाइक पेशेंट. सो कहाँ से आया मायोपिया? इतना मायोपिया? समवेयर इज द प्रॉब्लम. लाइक सम व्हाट वी आर एग्जामिन, दैट इज समहाउ इज नॉट करेक्ट. इट्स नॉट सपोज टू बी, right? So maybe your examination system you need to change. So if you take this all two way you have to identify a patient. If patient is complaining like, yes, I have a visual stress or maybe headache and asthenopia, so you try to ask them. This is the questionnaire you will get in from COPD that you ask. If you see if score is 7 or below 7, then you can advise for a binocular vision examination, right? That is as per the questionnaire wise, or you can say as a symptom wise, right? Similarly, you clinically you see cover test, you see NPC and NPA, at least these three. If you see any type of disturbance or any type of abnormality you are feeling, then you have to be advised for binocular vision examination. Then you have to see all parameters. Yes. What is the normal exophoria? What is the phoria normative data for phoria? No, phoria का normal range. How much is the phoria normal range? 2 to 4 exophoria per year. Perfect. Right? So you, even if I am orthophoric at near, I am not normal. Yes. But sometimes we are feeling as a orthophoric, may not be I am orthophoric, right? Because you have a system, your motor and sensory system is there, they're trying to control it, right? So lot of impact on that. Similar things like there's a lot of researches has been proved that because of simple non-strabismic binocular dysfunction, maybe accommodative problem or eye movement problem or vergence problem, so a lot of academics can be hampered. A lot of child is there right now, I'm telling you, right? They are not concentrating. Why they are not concentrating? आप लोगों ने एनपीसी चेक करते हो? हाउ टू चेक एनपीसी? यस, कैसे चेक करते हैं? क्या देखते हो? डबल हो जाए, कहाँ ब्लर हो जाए, कहाँ ब्रेक हो जाए. ठीक है, मान लो मुझे यहाँ डबल हो गया, तो क्या होगा इसका? या ब्लर हो गया, मुझे इनसफिशिएंसी हो गया. नो, थोड़ा सा वेट. दैट इज ओके. नाउ ही इज राइट, ही इज सेइंग राइट वट एवर ही इज रेड. दैट इज परफेक्ट, नो प्रॉब्लम ऑन दैट. इज एब्सोल्युटली सेड राइट. नाउ आई एम टेलिंग यू समथिंग डिफरेंस. वेयर इज माई अनकंफर्टेबल जोन? दोनों थोड़ा सा डिफरेंस है. Here is my uncomfortable zone, or maybe here is my uncomfortable zone. If I read here or here, patient कभी comfort होंगे? Will you be able to read? Your comfortable zone is here, okay, but you are reading here or maybe here. You understand what I'm trying to tell you? Got it or no? So what we are so-called saying NPC, like blur, break, recovery. So when you do NPC, lot of patients, they try to hold their breath. You just see why they are holding their breath. Because they are stressing, right? And put a simple plus lenses and see they are relaxed. They are NPC. अब जिसको बोलते हैं NPC, उसका प्रॉब्लम है ना. आपने NPC किया, you again put a plus 0.5 or 0.75 and do the NPC once again. You see it's change in fraction of second. यहाँ से suppress हो रहा था, now patient is कर्बाजी up to you. You try in your, अगर कोई friend को आपका है जिसको हम NPC problem है, you try on that. You see it will change fraction of second. अब दोबारा NPC का change हो जाएगा. So means what? So they are over converging. And what you are making with the plus lenses, you are making them a little bit periphery, right? And that's your job is done. But अगर आपके पास गया, आपने क्या किया? -0.5 प्रिस्क्राइब कर दिया and you are just introducing your myopic, right? So when you are assessing, two things you need to see. One is you can consider as a sensory. One is I don't want to confuse you more, right? So जो आपके दिमाग में जो अभी अपने किया उसके ऊपर ही बेस करके थोड़ा सा ये करता हूँ, ठीक है? सो वन इज सेंसरी, वन इज मोटर फ्यूजन. सेंसरी सो टू टेस्ट यू नीड टू सी. वन इज वाटफोर्ड डॉट एंड स्टीरियोप्सिस, राइट? इनको तो साथ साथ दिखाते भी रहो तो फिर हो जाएगा फिर, बिकॉज हमारे मैडम तो आ ही गया नेक्स्ट सेशन के लिए, ठीक है। सो थोड़ा सा बता दूँ स्टीरियोप्सिस के बारे में। स्टीरियोप्सिस इज अगेन टू टाइप ऑफ स्टीरियोप्सिस, वन इज लोकल स्टीरियोप्सिस, वन इज ग्लोबल स्टीरियोप्सिस। वेरी गुड, सुप्रिया सर का स्टूडेंट हो क्या? हाँ तभी लग रहा है, थोड़ा सा रिस्पॉन्स यहाँ से आ रहा है ना। So one is global stereopsis, one is local stereopsis, right? So what we are using, this is a global stereopsis, that is random stereopsis. So local stereopsis basically that is check only the central stereopsis, right? Whereas global stereopsis they check central and the peripheral both, right? So when you purchase a stereopsis, always try to take a global stereopsis. So you will get a lot of ranges basically for amblyopia strabismic patient. You will see in amblyopia or strabismic patient stereopsis आप check कर रहे हो, there is no stereopsis. So what you write, we write stereopsis is absent. So stereopsis कभी absent नहीं हो सकता है. Maybe you can write central stereopsis is absent. That word is correct. But if you write stereopsis is absent, that is not correct. If you check with a global stereopsis or random stereopsis, you will get a stereopsis maybe 800 or maybe 1000. You can check up to 2000 second mark, right? Now fusion में क्या करना है आपको? How will check the fusion? You check near and distances both, right? I'll tell you, check in all gauge, 9 gauges में देखो, check in more dynamic rather than the static. Dynamic means what? Like patient is walking and you just see, इसको भी try करो, right? So थोड़ा सा दूर से करो, हाँ. So how will check?
First we have to give the awareness. What are you seeing? Now speed. So you have to check the fusion from the here 33 centimeter and from at least 1 meter and 6 meter. One for intermediate and one for distance. This one is in static position. Then you have to check it from the different gauges. So what are you seeing now? How many dots are there? 4 dots. Now you don't have to. Now 4 dots. Now 4 dots. Now 4 dots.
ठीक है. So okay, we don't have so much time to explain. And then what you do, dynamic वाला दिखा दो थोड़ा सा please, जल्दी जल्दी.
Yes, you have to put the unbalanced condition, right? You have to put your yes. What are you seeing now?
So basically, so when patient is walking, patient is moving their, stretching their hand. When they're walking, you check what for dot. Why I'm telling you, you'll see a lot of, in case of amblyopia and strabismus, they will showing as a suppression. Right now you are as per the Watford dot is suppression. And what I say, can you stretch your leg? Can you stretch your body and see? Now patient is saying, yeah, I can see 4 now. Yes, I can show you that. Right? If is amblyopia patient, I can show. They have seen, they are seeing every day, right? So means we are in dynamic, we are not static. Human static है ही नहीं. So why will check? उसमें check करना है और इस पे check करना है. You check in dynamic. And 9 gauge का क्यों चेक करना है? Let's say if patient is strabismic patient, we'll try to find out where is the fusion. So जब मैं when will start my therapy, I'll start from that gauge. Let's say patient have little bit fusion on this particular gauge, not in primary gauge, right? So my therapy I'll start from fusional area to non-fusional area. So first I'll try to develop in fusional area. Once it will develop little bit, then automatically in all gauge भी थोड़ा थोड़ा developed हो जाएगा. You understanding why I'm checking? This is specially for strabismic and amblyopic patient. Definitely you need to check, right? So these are the something different. Now in term of eye movement में 3 parameter है. One is fixation, second is your saccadic eye movement and pursuit, right? Fixation आप saccadic के लिए आप I will just give a 2 finger and just try to them look at from here to here. Like you see the how is fixating from this distance to this distance, right? Pursuit के लिए we are just this is for the tracking, like how eye is moving or tracking, right? And the fixation is very important. A lot of patients with the nystagmus or maybe attention disorder function problem, they are not, their fixation is not for the longer time. They are not able to fix it, right? So that is the called eye movement. Accommodation के लिए you will see, for which one, binocular or contact lens, कौन सा है? For which workshop, for binocular or contact lens? Please come, because contact lens madam also here, no, so I'm confusing for because we are supposed to finish in 15-20 minutes. इधर आ जाओ, इधर जाएगा, इधर आ जाओ, उधर बेटर, right? So accommodation and virgins, right? So accommodation में आपको दो चीज़ देखना है, one is the strength of the accommodation and how is the facility of the accommodation. Similarly for virgins you have to see convergence, divergence and distance. And I'll tell you very briefly, then you will understand. I don't know, मैं थोड़ा सा skip कर रहा हूँ. This is very important. 10 to 15% normal school going population, they have a oculomotor problem. This is not my word, this is a research word. Like 10 to 15% population is not a joke, it's a huge population, right? Who are going in normal school, they have psychic pursuit problem or fixation problem, only oculomotor things, right? 96% of learning disorder population, they have a oculomotor problem. 90% of traumatic brain injury patient, they have a oculomotor problem. So it's huge, right? So whenever you see, you need to see oculomotor properly. So what are the others oculomotor parameters like EOMs, gross pursuit, gross circuit, DM test and King David test? This is the test or the visiograph or retrolyzer to test your circuitic and pursuit. I don't know, I have a photo or not. If I photo, this is something called NCUCO, the Northern Southern College of Optometry. They have developed this grading system. If you have a one-time fixation loss, so you can make a grade 4. ऐसे करके grade 1, grade 2, grade 3 or maybe 0 to 4 आप कर सकते हो, right? This is not for research. This is a DM one. How will DM? I'll tell you. If you see the first test A, that is you have to read 3, 4, 7, 5, 5, 2, 9, 1, right this way. Test B also similar. Test C is little bit difficult. So you need to see where is the error. So error means what? Like substitution. 9 के जगह उसको 6 पढ़ रहा है patient. You understand? That is one error. Patient is omitting this line. Patient is reading 5, 3, 7, 4 and they are jumping to the another line. So that is also one error. That is called omission, right? Addition. यहाँ पर 9 जो इधर था वो 9 इधर एक्स्ट्रा रीड कर रहे हैं, राइट? देयर इज अ नो 9, राइट? सो ऐसे करके यू हैव टू बी फाइंड आउट कि व्हाट इज द एरर. देयर इज अ कैलकुलेशन इज दैट इज वेरी सिंपल एंड देयर इज अ नॉर्मेटिव डेटा फॉर एवरी पेशेंट. ऑलरेडी इट हैज़ बीन क्रिएटेड, already has been there. You have to just see what is the ratio of that particular child and what is the normative data, where they are falling, right? Everybody understood? Similarly, King David test also very easy. You are reading from this, let's say 1, 2, 4, 5, 6, then little bit difficult, cross, more difficult, okay? And this is much difficult. So you have to be maintain the line. You are able to maintain the line or not. Like when you are jumping from this line to this line, so actually what you are doing a cyclic eye movement, right? When you are reading like this and then you have to jump to the next line, so you are doing a tracking, right? So if patient have cyclic eye movement and pursuit problem is there, they have a problem in their reading and writing and understanding comprehension, so all are related, right? Similarly, King David takes also have normative data for in every ages, so you have to just find out. This is a retrolyzer. This is this is very unique and this is very easy because the previous those two tests is very difficult to respond for the kids. I don't know how many you have heard about autism spectrum disorder. Maybe I hope you all of know autism spectrum disorder. Even it has been proved before neurologist and optometrist can diagnose autism spectrum disorder. How? With the retrolyzer. The first symptom is the eye contact. If you see the autism spectrum disorder, they don't do the eye contact, means cyclic pursuit and fixation, right? So even a 6-month-old kid, if you wear a retrolyzer, they don't have to respond, right? They don't have to read. You just show them whatever they want to see, maybe fruits picture, maybe color picture, whatever, and automatically they will calculate and tell you either this child will become this autism spectrum disorder or not. right? So even neurology is also missed, in early age, like either this child is autistic or not. So this is very, very good equipment. Simply just wear and just see where it is. So when you are managing oculomotor disorder, refractive is very, very important. Which is already I have told you, addition glasses for near, which is very important. Obviously, vision therapy. Then accommodation. The test is pull away, push up, minus lens test. How many you know? Pull away, push up. अरे जो आप एनपीसी करते हो वही तो है, right? So two things you keep remind: the accommodation is a monocular as well as binocular phenomena, but your vergence is always a binocular phenomena, right? So whenever you do the any accommodation test, always you do monocularly as well as binocularly. So push up, pull away. समझ में आया? पुश अप मीन्स कहाँ आप इधर से इधर आ रहे हो, पुल अवे मीन्स यहाँ से कहाँ सिंगल हो रहा है, राइट? माइनस लेंस टेस्ट यू कैन डू फॉर द नियर, जस्ट सिंपली आप माइनस लेंस डालते जाओ मोनोकुलरली एंड बाइनोकुलरली एंड सी वेयर इज द ब्लड इज गेटिंग, राइट? एंड MEM retinoscopy, dynamic retinoscopy is very important because it will tell everything. What is dynamic retinoscopy? Actually, you are looking into the brain. We are just lag of accommodation or lead of accommodation. सिर्फ ए नहीं है, इसके बियॉन्ड में अब आप प्यूपिल चेक करके मैं बता दूंगा. अभी मैं सीख रहा हूँ, मैं भी सीख रहा हूँ कि पेशेंट इज इन डिप्रेशन और नॉट. आई जस्ट सी प्यूपिल एंड टेल यू कि पेशेंट डिप्रेशन में है कि नहीं है. द प्यूपिल एग्जामिनेशन इज वेरी इंपॉर्टेंट. जो प्यूपिल एग्जामिनेशन कैसे करते हैं, पहले होता था ना, डॉक्टर आते थे, प्यूपिल चेक करते थे ना कि मर गया कि जिंदा है. Yes, so this is the window of the brain, door of the brain, right? So all they are reacting or maybe sluggish reaction, how? So you need to understand that. If you understand this art, you can do whole lot of things, right? Then facility. So dynamic retinoscopy basically will tell you lag and lead of accommodation. There is a normative data is there, that is plus 0.5 to 0.75. If it is getting more plus, so that we will consider as a lag of accommodation, which is insufficiency of accommodation. If it is this side, lead, even plano also lead, that is called a excess of accommodation, right? ये तो आप जानते हो लोग अच्छे. Facility means you are checking how flexible your accommodation, we are able to deliver or not, right? Yes. Yeah, means stamina means strength, that is amp of accommodation. Facility means you have, let's say you require a 10 diopter accommodation, you have 10 diopter required, right? But will you able to deliver or not, right? Yeah. So I am not, this is a MEM retinoscopy, dynamic retinoscopy. So you have to do from retinoscopy here. This is the MEM card can use, and when patient is reading means when patient is accommodating, that time you have to check is a lag or lead, right? Yes. This is facility. This is for flipper. ACY ratio, one again important parameters. How many you know ACY ratio? No? Yes. How will check? Simple method आपको, there is a two method, one is calculative, one is gradient. Always you do it gradient only. Calculative is not all the time correct, right? So how to do, I'll just tell you, very simple. आपने फोड़िया चेक किया, ये फोड़िया वाला दिखाया नहीं तो इनको है ना, बस दिखा दो, इनको दिखाते रहो एक बार. थोड़ा सा स्टैंड करके दो, ऐसे करके दो, सबको दिखेगा. So you can make your own. This is called Howell Fourier card. You can make your own, right? इसमें कुछ नहीं है, एक यहाँ पर जीरो जो यहाँ पर है, हर this is not Thorington card actually. This is not tangent scale. You can make a 0.4 का डिस्टेंस फॉर नियर, हर पॉइंट पे डिस्टेंस के लिए 1. ठीक है, तो आप बना सकते हैं इसको खुद से. थोड़ा सा ऐसे रहो तो दिखेगा, फिर सबको दिखेगा. हाँ, राइट. सो यू जस्ट होल्डिंग योर, जल्दी करो.
पेशेंट को पहले आपको जस्ट मैडॉक्स रॉड पकड़ना सिखाना होगा, देन हाउ टू हैंडल दिस. सो यू जस्ट हैव टू put it in front of eyes and ask him, are you seeing a vertical line or horizontal line? vertical line. See, the patient is in the vertical line. So what will we check? We will check
horizontal podium.
is the line is aligning with the light or
नो नो वो तो दिखाओ पहले.
this one or this one?
सिंपली देखो, सिंपली ऐसे करना है. इसका ईजी क्या है, यू विल कम टू नो. पेशेंट को जब आप बोलो कि लाइन कहाँ पर है, कौन सा नंबर के ऊपर है, दैट्स इट, राइट. कौन सा नंबर के ऊपर, जीरो मीन्स ऑर्थो हो गया, सिंपल. अगर इस साइड हो गया तो एक्सो, इस साइड हो गया तो ईजो, ऊपर हो गया तो हाइपर, तो इसका ईजी है, राइट. और ए आपका डिस्टेंस के लिए है. सिमिलरली हाँ, दिस इज फॉर डिस्टेंस. सिमिलरली डिस्टेंस से पूछो कौन से नंबर के ऊपर है, तो वॉट एवर इट इज़ यू जस्ट सी एंड ट्राई टू, यू डोंट हैव टू न्यूट्रल विद द प्रिज्म. जो आप करते हो ना कि प्रिज्म से न्यूट्रल करना है, फिर ये करना है, तो उसमें ज़्यादा टाइम लगता है. दिस इज़ वेरी ईजी फॉर किड्स ऑल्सो, क्योंकि वो उतना समझ में नहीं आएगा प्रोसेस कि हाँ कहाँ गया, कैसे हुआ, लाइन कैसा है. सिंपल पूछो लाइन कहाँ पर है, जहाँ पर भी लाइन है दैट फोरिया, राइट. एंड नाउ ACY रेशियो, let's say you have checked my foria, let's say 4 exophoria, again you have to check foria with a -1, both eye -1 you put and check foria, how much the changes, that is the ACY ratio. Let's say it was 4 and now it is become 1 exophoria, so कितना चेंज हुआ, 4 से 1 3 चेंज हुआ, so 3:1, that is ACY ratio. समझ में आया? Yes. So this all are the expected finding as per the age. Now disorder में accommodation insufficiency, ill sustain, excess and infacility. Now we are jumping to a virgins part. We don't have time. Virgins में दो चीज़ आपको देखना है. One is a direct method, one is a indirect method. What is direct method? The test which involved with a prism. That all are direct method. The test is involved with a lenses, that is इनडायरेक्ट मेथड फॉर द वर्जिन्स. हाउ विल आई गिव एग्जांपल. एनपीसी को आप जो चेक कर रहे हो इसको आप प्रिज्म में कन्वर्ट कर सकते हो. आईपीडी यहाँ पर, आईपीडी यहाँ पर, सो जो डिफरेंस आईपीडी होगा वो यू कैन कन्वर्ट इन प्रिज्म डायोप्टर. सो दैट इज, इसलिए इसको हम बोलते हैं डायरेक्ट मेथड. सेकेंड पीएफबी मीन्स पॉजिटिव फ्यूजनल वर्जन्स बेस आउट, जिसको हम बोलते हैं कन्वर्जेंस स्ट्रेंथ, राइट. दैट विल चेक इन नियर एंड डिस्टेंसेस and will check with a prism again. So this is a direct method. Similarly NFB base in vergence, and this is also called divergence. So that is, this all are three and vergence facility. Vergence facility के you can choose two. One is 12 prism base out and 3 prism base in, and 15 prism base out and 5 prism base in, right. ये choose कर सकते हो. तो इसके लिए आपको आपका सारे direct method is right. Now in case of indirect method, so where the lens is involved, right. So you just see NRA. So NRA how will do is, it's a binocular thing, so we'll do the plus lenses, right. So you are putting plus lenses and you are relaxing your accommodation, so eye bahar ja raha hai, but brain have to maintain the binocularity. So what will do, the brain will converge. So this is an indirect method of convergence, right. Similarly PRA is with the minus lenses and similar things, right. Yeah. And binocular accommodation because the lens is involved. Cover test, you need to see unilateral cover test and alternative cover test, right. One will tell you the which eye is fixating and non-fixating eye, and another will tell you the amount of the misalignment, right. So जो मैंने दिखाया थोरिंगटन कार्ड. So NPC को आप दो तरीके से कर सकते हो. One is with the accommodative target, which is this one. So here accommodation also involved. Also you can use a red and green filter. Can you just give me the red and green filter? Can you just wear it? So patient, you have to ask when it is double. So let's say patient is saying it is double and single. So only you will see two parameter, because here accommodation is not involved, right. Whereas in RAF ruler is accommodation is involved, right. But I believe this procedure is better than accommodation, because if someone patient have accommodation excess or insufficiency, maybe you will misdiagnose के patient NPC, right. So better to do with the RF ruler. You can use a red and green filter or whatever, red blue filter, and use it. Then vergence facility already have. Now this all are the expected value, and I'll tell you one example. A patient, so direct method, you know what, NPC, NFB, PFB, Virgin's facility, right? In which are involved with the prism, right? अगर कोई पेशेंट का बेस आउट प्रिज्म में डिफिकल्टी है, सो मीन्स व्हाट, कन्वर्जेंस प्रॉब्लम, राइट? क्योंकि ऑलरेडी यू नो कि बेस आउट वर्जेंस विल चेक द स्ट्रेंथ ऑफ द कन्वर्जेंस, राइट? इनडायरेक्ट में कौन सा होना चाहिए बताओ, प्लस या माइनस में, एनआरए या पीआरआई कम होगा, अभी तो बताया प्लस ना। से देखो, if you are putting a plus lenses, so what is happening, eye is relaxing, right, is going out, but brain have to maintain the binocularity. So what brain will do, converge, अगर मेरा convergence ज़्यादा है तो मैं ज़्यादा प्लस खा सकता हूँ, समझ में आया? So two things for convergence insufficiency, one is the base out problem, one is the plus lens problem. जितने सारे टेस्ट है, बाकी टेस्ट आपको बताइए, जस्ट ऑपोजिट फॉर द वन मोर थिंग, फोरिया वैल्यू को आप उसको रख सकते हो नियर एक्सोफी, वो छोड़ दो, अभी जरूरत नहीं है, बिकॉज वी डोंट हैव टाइम टू एक्सप्लेन ऑल दिस थिंग्स, राइट? और एक चीज़ को आपको ध्यान में रखना है, कन्वर्जेंस कहाँ होता है, नियर पे, राइट? सो जो बेस आउट वैल्यू और प्लस लेंस वैल्यू विल बी लो, दैट इज ऑन नियर। सेम चीज़ अगर बेस आउट और डिस्टेंस पे हो जाए तो क्या होगा, अगर बेस आउट वैल्यू कम है तो क्या होगा, वेरी गुड, ठीक है, हो गया। अब यू कम टू द कन्वर्जेंस इनसफिशिएंसी एक्सेस, इसमें क्या होगा, बेस इन प्रिज्म वाला, राइट, एंड माइनस लेंस वाला। डिस्टेंस में क्या होगा, डाइवर्जेंस इनसफिशिएंसी, बस हो गया, चार खत्म, समझ में आया? अब टेस्ट को थोड़ा सा आप देख लेना। और एक डिसऑर्डर है दैट इज कॉल्ड फ्यूजनल वर्जेंस डिसफंक्शन। सो मीन्स क्या है, पूरा सिस्टम में ही प्रॉब्लम है, राइट? तो पेशेंट हैव डिफिकल्टी इन कन्वर्जेंस, डाइवर्जेंस, योर प्लस मीन्स प्लस लेंस, माइनस लेंस ऑल्सो पेशेंट हैव डिफिकल्टी, बेस आउट वर्जेंस, बेस इन वर्जेंस ऑल्सो डिफिकल्ट, राइट? समझ में आया? अभी के लिए तो इतना ही है, मैम बैठे हुए हैं सेक्शन के लिए। सो इफ यू हैव एनी अदर क्वेरी, सो यू जस्ट, कुछ क्वेरी है तो बताओ, एक दो बता देता हूँ। क्वेरी है? सो एक दो मैं वीडियो दिखा देता हूँ, सो जस्ट 2-5 मिनट का। सो सम क्यों चल नहीं रहा? सम एक्टिविटी में दिखा देता हूँ जस्ट। So this is some oculomotor activity you can see. So what you are doing actually, basically you are working on secreting and pursuit both, right? Yes, because you have to find out where is the number, you have to click, and it's rotating, you have to track also, right? Then this is for, you can see the something for convergence and divergence. So you just, patient is focusing on the center, patient is wearing red blue glasses, and you are separating, you have to maintain the single, so means you are converging or diverging as per the glasses, right? So this is something called, I have a lot of things but I don't know. Similarly, this is also random divergence. So patient is doing and is separating, patient is wearing red blue glasses and is separating, patient what is maintaining, the patient is getting 3D, right? तो जब तक पेशेंट कन्वर्ज कर पाएंगे तब तक वो 3D देख पाएंगे, जब नहीं देखेगा देन गॉन, राइट? You can use, this is something called anti-suppression, this is called bar reader. So you know patient is wearing red green glasses and you can use any letters, आप कोई भी रीडिंग मटेरियल दे तो उसके ऊपर डाल दो, एंड जस्ट पेशेंट इज रीडिंग विद द रेड ग्रीन फिल्टर, एंड पेशेंट एंटी सप्रेशन मीन्स बोथ आई को एक साथ में काम कराना, राइट? अप्रोचिंग, द फर्स्ट अप्रोचिंग, राइट? दिस इज ऑल्सो सिमिलर, लाइक this is also you can use here एज ए एंटी सप्रेशन, right? You can on audio, you can off audio, you can change the color. Basically this gadget is used for autistic and cerebral palsy patient. This is also some video for psychiatric one pegboard, right? So it's rotating and you have to just put your falling, So this is perceptual therapy. I have not discussed about perceptual therapy, so I don't want to confuse. This is something called Berneloscope. So it's similar like for convergence and divergence, patient have to, you here target is there. I don't know, we don't have right now. So, okay. This is for amblyopic patient. So just patient, this is for also pursued this is very good exercise for the amblyopic patient, right? So they have to just track it. Right? Okay. Thank you so much. If anyone have a query, I'll happy to answer. आपका 7 मिनट एक्स्ट्रा ले लिया मैंने.